Angelique Newman, COO and Director of the ECAP program for RN Cancer Guides. I'm also a very recent breast cancer survivor. While everybody's cancer treatment is different, everybody's cancer is their own, I encountered specific barriers that made it very difficult for me as a cancer patient. I worked throughout my cancer treatment. I found it very difficult to try to coordinate appointments, to make sure that all of my providers, because many people don't realize there could be 7, 8, 9 physicians and nurse practitioners that are assisting in your care and your treatment, trying to make sure that they're all on the same page and that they all have the same medical records and that they're all working as one cohesive unit. We don't know what we don't know. And as a patient facing cancer, there are so many resources out there for us. And it's all about just knowing who to go to, who to turn to, and what to ask for. That's important. As a caregiver, it's very important to utilize all the resources available to you because it's going to help take some of the strain and the stress off of what you're enduring day in and day out, taking care of this person that you love so dearly.
Hi, I'm Susan Scheer. I'm the CEO and founder of RN Cancer Guides. RN Cancer Guides is a firm that helps cancer patients and their families navigate all the aspects of their cancer diagnosis, whether it's medical, financial, or emotional barriers, using oncology certified nurses. Oncology certified nurses are specialized nurses. They know the genomics, the genetics, the different pathways, how to look for clinical trials, and to help a cancer patient, even with the psychosocial aspects of their care. We not only help the patient, but we also help the family as a whole unit. I too had experiences in my family where I became the navigator. I had a brother-in-law that was diagnosed with a brain tumor, and at that time I was actually involved in neuro-oncology. So I was the first one to see his scans. I knew right away what we had to deal with and what kind of battles we would incur. So for that reason, I took over that case and I thought, oh my God, what would happen if patients and families, they don't have the resources that I have available? How can they even navigate any of this? Cancer seems to be like you're on a whole different planet. It's a different language. People are talking in acronyms. You don't understand what they're saying. Everything's on different time frames. There's different providers. There isn't just one doctor treating one part of the diagnosis. There's surgeons, there's oncologists, there's radiation oncologists, there's pathologists, there's nutrition. There's all these different entities. How do you even pull this together? And how do you even know if you're seeing the right physician? So it was very important, after seeing all that, to know that the only way that I felt like I could make a difference and utilize the skills of my fellow nurses that have been doing this all along was to start an organization that could help these people. And the nice thing with this is we're not beholden to an insurance company, we're not beholden to an institution. We are beholden to the family. We are your nurse in the family. And why would anybody go into a cancer diagnosis without having an expert next to them? If I had my way, everybody would have one of these nurses. That's how I want the future to be. The medical team will expect it, and the patients will expect it. But they don't have to face cancer alone.